and now I am going to upload the video of practicals of first year MBBS. If you want to know about the books, you can just click on the video I had already uploaded. So let's go with this video with the physiology practical. So first on the list we have the spotting. There are 10 spots that are being placed. First is a structure is being placed under a microscope and you need to identify that which type of WBC it is or RBC it is. Then after it you have a graphical representation. Many graphs are being placed and you need to know about which graph it is. And there are many tools like myograph, kymograph, Lucas chamber and many other things are being placed and you need to identify it. Now let's begin with the hematology. Hematology is the second practical of physiology. And in hematology there are two questions that are given to each of the child, and which includes like estimation of HP and determination of or the count of the number of RBC, WBC, TLC, DLC and bleeding time, clotting time and many more questions, but only two questions are being given to each child and you get a sufficient time to complete each of the practical. Now about the human lab. Human lab also includes two questions. The questions can be, there are, as you know that there are 12 cranial nerves and we have reflexes as well as to check the sensory nerve supply as well as motor nerve supply. And subject has been provided to us and we need to examine the subject, and the examiner is there to let us know that we need to take out the appropriate patient history and then we have to do the experiment. After it we enter to a clinical lab where there are, as we all know that there are diverse number of experiments in clinical lab, which includes vitalogy graphs, spectrography, ergography and many more, and again you get at least one question in this and a Viva is being placed in the clinical lab. After that you enter to a amphibian lab and there are a lot of graphs are being placed to it and an examiner can ask any of the graph. My graph was of simple muscle twitch and it was easy and I came back with a good smile after completing my practical. Now I will be telling you about the anatomy practical. It is one of my favorite practical among all of the three. So first, as we have the spotting in physiology, now again we have the spotting in anatomy as well. There are 10 spots have been placed, 4 to 5 structures of histology and some soft organs are also been placed, in which you have some site is being pinned. And then also we have some images of McBurney point and many more, and we need to identify each of them. After that we have bones. At least you must know about the site determination of each other bone and some ossifications. Examiner can ask the ossification of when the bone has been ossified. After that in bones also we need to know about the muscles. Muscles, origin, insertion, nerve supply and action of each of the muscles that are being inserted in a particular bone. In the soft part practical of anatomy, there are various organs are being placed. Also the lower limb and an upper limb is being placed, and an examiner can ask, first of all you need to know about which organ it is. Second, you need to know the site determination of a particular organ. Also the examiner can ask a particular anything about that organ. After that, in the lower limb or upper limb, there are various muscles and the examiner can ask that from where the particular muscle is being origin, insertion, nerve supply and action of a particular muscle. During my practical time, the examiner has asked me the boundaries of femoral triangle and the organ I need to pick up is the right lung. Now about the histology Viva. A slide is being placed under a microscope and you need to just know about what type of histology structure it is and an identification feature you need to know tell about to your examiner. After that of embryology you need to know about the development of each and every organ. Any organ is being placed and you need to know, especially of tongue or you need to know about pancreas, liver, etc. and examiner can ask you, they are easy. Now in the radiology Viva, X-ray has been placed and the examiner can ask about which part X-ray it is. As you guys all got to know that anatomy practical is one of my favorite practicals, so I would like to share my experience of on the day of my anatomy practical ki kya kya hua tha. So there were 10 spots they were being placed and there were many of the spots that I was being able to identify them. I know that the lateral view of brain was being placed and a side of the pin was being placed at a lateral ventricle. I need to find out the boundaries of it and I was able to do so. And histology structures were also pretty easy to identify and write their features, that why I am able to identify them. After that I entered to the bones Viva, where the examiner has asked me about the mandible bone. I was quite disappointed at that time because I had done each and every bone quite well, but mandible was little, the graph was little down, but still I was able to, at least I was able to identify them, but it's fine. After that, I entered in the soft parts Viva. It has asked me about to find out the boundaries of the femoral triangle. It was quite easy and I was able to identify them. After that, examiner has asked me to hold the right lung and about what are the structures that has been below right lung. Then entered in histology, I got the slide of liver, and to identify it, it was easy because I told them their hepatocyte structures, portal, triad, and many more. Now about the embryology. Embryology, I got the development of tongue. I thought that I need to explain all the development of tongue and how it takes place, but I need to just identify the structures like about what is lingual swelling or foramen cecum. If you just know the diagrams properly of the development of each and every organ, you can just easily find out or identify, or you can just answer to the examiner properly. And now about the radiology experience, I got the lateral view of the foramen arm, and the examiner has asked to identify the ulna bone and what are the structures above the ulna and where is the head of the ulna, like coronoid process, oligurine process, and I was able to identify them. So now about the biochemistry practical. In biochemistry, there are 5 spots are in place. Any of the vacuum cleaner is being kept, or graphs, enzyme graphs. Now about the practical of biochemistry, we have 2 practicals, that is of calorimetry and urine analysis. In calorimetry, the questions can be find out the estimation of glucose or find out the estimation of creatinine, urea, etc. In urine analysis, you need to find out that your urine contain carbohydrate. If carbohydrate has been present there, then it is a positive Benedict test. If ketone bodies is present, then it is a positive Rotha's test. If bile salts are being present, then is a Hay sulfur test. And 5 to 6 experiment we need to do in urine analysis. And also we need to write about the physical features of the urine. After that, in this practical only, you have a Viva, an examiner come to your seat and you need to just tell about, examiner can ask to what type of a question is being given to you about your calorimetry and urine analysis, and then you need to tell the particular answer. Then is the grand Viva. I will tell what are the questions asked to me in the grand Viva was the classification of enzymes, urea cycle. It is one of the most important question. You need to know about the urea cycle, and xenobiotics. Anything an examiner can ask you. If you have prepared well for your theory exam, then this practical will be quite easy for you. After seeing this video, hope you get a brief idea regarding what are the practicals of first year MBBS, and I hope that you will give them best. Thank you. Bye bye.